Welcome to the Caregiver Corner series, where we will discuss various topics specific to the NICU. In this module, we will discuss your role in the NICU, ways you can participate in your baby's care, and how your involvement can help build confidence as you prepare to take your baby home. Having a baby in the NICU can be an unexpected and overwhelming experience. Many parents describe feeling scared, uncertain, or unsure of how they can help their baby during this time. While the NICU team provides specialized medical care, you are an important part of your baby's care team. Your presence, your voice, your touch, and your involvement all play a meaningful role in supporting your baby's growth and development. By the end of this module, you will understand how you can actively participate in your baby's care throughout their NICU stay and why your involvement is so important. You will be able to describe your role as a member of your baby's care team, identify ways to participate in daily caregiving activities, understand how caregiver involvement supports development and bonding, recognize how participation builds confidence for discharge. When your baby is in the NICU, you may see many healthcare professionals involved in their care. Many specialists work together to support your baby's medical and developmental needs. Let's review some of these roles together. Neonatologist, the doctor who specializes in caring for newborns in the NICU. Neonatal nurse practitioner, an advanced practice provider who helps manage your baby's medical care. Bedside nurse, provides your baby's daily care and keeps you informed. Occupational therapist, supports your baby's development, positioning, feeding readiness, and caregiver education. Physical therapist, helps with movement, positioning, strength, and motor development. Speech-language pathologist, assesses feeding, swallowing, and early communication development. Respiratory therapist, manages breathing support and respiratory treatments. Lactation consultant, helps with breast milk expression and breastfeeding. Registered dietitian, ensures your baby receives the nutrition needed for growth. Pharmacist, reviews and manages medications to ensure they are safe and effective. Social worker, connects families with emotional support, resources, and discharge planning. Case manager, helps coordinate care, insurance, equipment, and follow-up services. Psychologist, supports the emotional well-being of families during the NICU stay. Child life specialist, provides support and education for siblings and families. Chaplain, offers spiritual and emotional support for families of all beliefs. Although the healthcare team provides clinical expertise, you are the expert on your family and your baby. As your baby grows, you will learn their unique preferences, behaviors, and communication cues. You are not simply a visitor in the NICU. You are an essential member of your baby's care team. Your observations, questions, and participation provide valuable information that helps the team deliver individualized care. As you become more involved, you may find that your confidence grows and your understanding of your baby's needs becomes stronger. Research has shown that caregiver involvement benefits both infants and families. When parents participate in care, infants have opportunities to experience familiar voices, comforting touch, and meaningful interactions. These experiences help support development and strengthen the parent-infant relationship. For caregivers, participation can reduce feelings of helplessness and increase confidence in caring for their baby. Each caregiving experience provides an opportunity to learn about your baby's strengths, preferences, and cues. Although your baby may be receiving medical care in the NICU, your relationship with your baby continues to grow through everyday interactions. Many caregivers are surprised to learn how many ways they can participate in their baby's care while still in the hospital. Participation may look different depending on your baby's medical condition and stage of development. Your baby's occupational therapist can help identify activities that are appropriate for your baby. Some examples of participation include talking, singing, or reading to your baby, providing gentle touch and containment, participating in diaper changes and temperature checks, assisting with feeding when appropriate, providing skin-to-skin care, helping with bathing and dressing, learning positioning and developmental care strategies, observing and responding to your baby's communication cues. One of the most meaningful sensory experiences for your baby is hearing your voice. Talking, reading, singing, or simply spending quiet time together helps your baby become familiar with your presence and supports bonding throughout the NICU stay. Even small moments of interaction can support bonding and help you become more comfortable caring for your baby. Remember that participation is not about doing everything perfectly. It is about building a relationship with your baby and gradually developing confidence and skills. The most important skills you will develop in the NICU is learning to recognize your baby's cues. Babies communicate through their behavior long before they can use words. They may show signs that they are comfortable and ready to interact, or signs that they need a break and additional support. As you spend time with your baby, you will begin to recognize these signals and learn how to respond to their needs. Throughout the remaining modules, we will discuss infant cues in greater detail and explore ways to support your baby's regulation and development. The NICU is a place of learning for families as well as healthcare professionals. It is normal to have questions. You may wonder why your baby is positioned a certain way, what a monitor is measuring, or how to safely perform a caregiving activity. Asking questions is an important part of participating in care. Your baby's occupational therapist is there to support your learning and help you feel prepared for caring for your baby both in the NICU and at home. Each new skill you learn contributes to your growing confidence as a caregiver. Over time, activities that once felt unfamiliar often become comfortable parts of your daily routine. One goal of NICU participation is preparing families for the transition home. Occupational therapists help support your baby's daily occupations, the important baby jobs of feeding, sleeping, growing, and engaging with the world. They also support your participation in shared activities, or co-occupations, such as diaper changes, bathing, dressing, skin-to-skin care, play, and other meaningful parent-infant interactions that foster bonding and development. Every diaper change, feeding, cuddle, and caregiving interaction is an opportunity to learn and prepare for the future. As your baby's discharge approaches, you will have opportunities to practice caregiving skills, ask questions, and become more independent in caring for your baby. The knowledge and experience you gain throughout your NICU journey can help make the transition home feel less overwhelming. Try this today. Talk to your baby when you visit. Your voice lets them know you are present and can provide comfort. Place your hand near your baby and simply observe their response. These observations can help you learn your baby's patterns, likes, and dislikes. Ask your care team about when care times are. These are times when the majority of diaper changes, feeds, and other activities take place. This helps prioritize undisturbed sleep times for growth and development. Your occupational therapist can guide you through daily NICU activities to participate in around these care times. You have made it to the end of this introductory module to the NICU. Key takeaways. You are an important member of your baby's care team. Your participation supports bonding, development, and confidence. There are many ways to become involved in your baby's care. Learning your baby's cues helps you respond to their needs. Every caregiving experience helps prepare you for discharge. Thank you for taking the time to learn about your role in the NICU. Your presence, participation, and partnership are valuable parts of your baby's care journey. Please speak with your baby's occupational therapist for individualized guidance and recommendations on activity participation. Remember, your healthcare team is here to guide and support you every step of the way.